So we're going to talk about breast implant removal and how it's done. What are capsules? Should we take out the capsule? And who goes for it? So usually removing a breast implant is a big decision. Most people have had it for a while. They've lived with that breast implant. It has provided them with volume and a certain shape that they're accustomed to. But now there's an increase in concerns about breast implant illness, or they just don't want to have a foreign object in them. They no longer like that aesthetic and want to opt for a smaller breast. They're having back issues or other issues from having a big implant that they wish to remove that implant. So they opt for removal. So breast implant disease has been a concern recently. So it's a conglomeration of multiple symptoms that people have that they attribute to having a breast implant. It's not very common. The literature hasn't proven a specific cause for it yet. And it is still a diagnosis of what we call exclusion. So if someone is complaining about certain symptoms that are usually in other areas of the body that they're attributing to the breast implant, usually we exclude most other diagnoses before we attribute anything to the breast implant. But certain individuals just don't want to have an implant anymore, or don't want to live with it anymore, or just having a foreign object in them that they would rather remove. In that case, we go for a breast implant removal. Do we take the capsule? What is the capsule? And is it safe to take it out? So when placing a foreign object in the body tends to protect itself by forming some scar tissue around it, which we call a capsule. It's normal to form that. It happens in most individuals, if not all. But the thickness of it and the consistency of it can differ if someone ends up having what we call capsular contracture, where the capsule itself becomes thick and it contracts on the implant. That can affect the way the breast looks, can give someone discomfort and pain, and at that point it's indicated to remove that capsule. Other indications for removal of the capsule can include individuals forming what we call anaplastic large cell lymphoma associated with breast implants. It's usually associated, it's a type of lymphoma that's associated with the old textured implants. It's not very common, pretty rare, but for individuals who've had textured breast implants in the past and they end up being diagnosed with that diagnosis, then we try to remove the capsule if it can be removed safely, such as if we can remove it from over the chest wall without actually having to injure the surrounding structures, then we go ahead and remove it. But for the most part, we definitely try to remove the top part of it that is facing the skin and the tissue on top. After the removal of your implant, or plus or minus removal of the capsule around it, then the next step will kind of depend on how big the implant used to be and how droopy the breast tissue is after the removal. Some individuals might need a breast lift, which we can discuss, or some individuals just want to get rid of the implant and the capsule and they don't care about how the breast looks later down the line, or they just don't want any more scars on the breast that they won't opt for a breast lift. But we're here to discuss those options with you and to offer you any solutions that you feel are necessary or you wish to have done during consultations.